The strange universe is still here, COVID is still here, and now there's just so much information being thrown at us from so many different angles, it's very hard to organize and categorize and parse the information correctly. So we got together with Dr. Dan Grove and other medical professionals to help sift through that information and find out what's the deal with COVID.
Okay, so we're here with another short video answering questions for the community. I'm here with Dr. Avi Rosenberg. Dr. Rosenberg, a pathologist at Johns Hopkins. So Dr. Rosenberg, tell us a little about yourself and what brought you to the COVID world.
My name is Avi Rosenberg, as stated. I'm a renal pathologist at Johns Hopkins, also with a subspecialty in pediatric pathology. In addition to that, I have a laboratory that does cell biology of kidney disease. So what brings me to COVID is, like many of our colleagues and physicians, we were redeployed to do all sorts of things, to help our communities, to help our hospitals, to help our society meet the needs and challenges of coronavirus. As a pathologist, one of my interests is in testing, which lives in the bandwagon of pathology. My first entree to outbreaks was with Zika virus several years ago when I was at Children's National Hospital. And when it was emerging that we were going to have a problem with coronavirus, I shifted some of my focus, some of my interest and efforts to testing, and in particular to see how we can deploy testing at the community level to protect our community in particular.
Okay, so just briefly, what are the different types of tests? Because it's very confusing out there. People are wondering, there's the rapid ones, there's the PCR, there's different kind of antigen tests, all these tests. What are the major sort of classes of tests that people might get, and what are their pros and cons of each?
The first test we all heard about was the deep nasopharyngeal PCR test. So when you get a PCR test, a polymerase chain reaction test off of a nasopharyngeal swab or an oral swab or a saliva test, what you're actually getting is usually 2 targets or more within the coronavirus genome that confirm that both amplified and therefore in fact you do have coronavirus. So the other test that drug companies and testing laboratories and companies have developed were these so-called rapid tests. And the rapid test sort of flips this on its head. Rather than looking at the genomic content of the virus, they're looking at the code of the virus. And those are composed of proteins rather than nucleic acids. And so we have tools, antibodies. You can use antibodies to detect that protein coat of the virus. Now, the major difference between the two is one of sensitivity, but because you're looking at the viral coat and protein matter, we don't have the same ability to amplify as we do for genomic material like nucleic acids. So what we rely on are fluorescently labeled amplification tools, which are somewhat limited.
Basically, I think what you're saying is that the rapid tests are rapid, but not as good, not as reliable, whereas the genetic test is more difficult to get, takes longer, it's more difficult to find, but it's a little bit better. Okay, so who should get tested, and which test should they do?
If you are symptomatic and you're feeling either a headache, a runny nose, stuffiness, difficulty breathing, a cough, headache, I think I mentioned headache, but fevers, all those symptoms that we're all talking about. If you are in the heat of those symptoms, then a rapid test with its limited sensitivity, but very good specificity. If you're symptomatic, that's a really good test.
So a positive rapid test, if you have symptoms, we believe that more than a negative rapid test.
Correct. If you are symptomatic and you have a positive test, then you are a bona fide positive and there's no testing out of a positive.
Right.
And we rely on it. However, you're symptomatic and it's negative, and your symptoms fall under the rubric of a COVID-related symptom, then we really have to go with a more sensitive test potentially and eliminate that false negative risk. And I would go so far as to say that even if you've had a negative test, but you still have canonical COVID symptoms, and you've had a negative PCR test, there are times where it's important to get a second PCR test.
Sure, I've actually seen patients in the hospital many, many times where they have all the symptoms. They came from a place with an outbreak. First one's negative, second one's negative, third one's positive. And we've seen that, and so the tests are not perfect.
Precisely. So they're helpful in establishing the diagnosis.
So they're good when positive, for the most part. When they're negative, though, maybe a little more difficult.
When they're negative, you have to use clinical intuition to establish, was there a high-risk exposure that might have put this patient at risk? Do the symptoms follow along with what one would expect for coronavirus? And if those two are established, then we enter, rather than the case definition, we end up with probable case definition.
And then you also have to factor in, well, what if we're wrong? And if this person then goes into a high-risk environment, or they live with somebody who's high risk, and we're wrong, then you have to take that in as well.
Exactly. And in the environment that we live in as a community, we really have so many interactions and so much cross-sectional interactions at every level between our families, our schools, our shuls, etc., that protecting the community is very important. And therefore, if you're symptomatic, we're really asking you, with or without a test, to really take yourself out of circulation. Let's establish whether what you have is COVID and or explainable by something else. But we need to understand the ramifications of doing a test and the limitations of testing.
Now, what if somebody doesn't have symptoms? Then what do we do? Let's say somebody is exposed to someone who is sick, and they want to get a test because, let's say they have to go into quarantine, and they say, well, I'm just going to take a test so that I don't have to stay for 14 days in quarantine. Why is that not recommended?
Right. So we have to address the kinetics of the disease and how the disease builds to its heat and your peak symptom day and then declines. So the numbers around specificity and sensitivity are frequently built around the day with peak symptoms.
So the test is more sort of reliable, I'd say, depending on when the person is in the course of their infection.
Exactly. And on either day of peak symptoms, the reliability of the test, not so much for positivity, but rather for being a false negative, is quite high. And in fact, it could be up to 30%. So to break that number down, that's 1/3 of all tests done on any given day, even in the peak symptoms, can potentially be negative.
So the reason then you're saying is you can't test out of quarantine is because if you get a negative test, it's very likely it's not correct, and you could be contagious and spreading that community.
Right, and especially if you're asymptomatic. So we have an idea called pretest probability, right, which is the likelihood that you actually have what you're testing for. And if that number is low, when you're asymptomatic, that number should be low, then the statistics surrounding the specificity and the sensitivity, how well the test performs, and its predictive value goes down. So we really have to be very mindful about how we use testing and use it in the right patients. So if you are symptomatic, you certainly should get tested because it will establish what you need to do and what your family needs to do. If you have high-risk exposures, there may be value in testing as well, because again, it will establish what you need to do and what your family might need to do. However, on the basis to test out of quarantine, to use the vernacular, we don't really test out of quarantine, because on any given day, one has the possibility of transforming and converting into a positive.
What does it mean if I test positive for antibodies?
Right. So antibodies are a very complicated matter. And the reason is because not all antibodies are created equal.
Right.
So when I say I can measure your antibodies that are quote unquote specific to coronavirus, what I'm really saying is that you probably had coronavirus, but whether those antibodies are actually effective at ameliorating a future infection or neutralizing a future infection, we really don't have that answer. And so not all tests are created equal. There are many antibody tests available on the market, many tests that are available on the market, and each one has different performance characteristics. So right now, the truth is, there really are no major decisions built around antibody testing other than your ability to donate convalescent plasma.
And we actually could throw another thing in. If you had antibodies 6 months ago,
what does it mean?
That they may be gone by now, right? I mean, we've seen antibody levels, and who knows what that means. And so it's really a risk. And so to summarize, so if you have symptoms, the reason to get tested is because you need to find out if you have the disease, you need to protect the community, you need to protect your family. And you should get a rapid test. And if you get a negative rapid test and you have symptoms, then we should not believe that that clears you. We should get the PCR test. And even a negative PCR test is not 100%. And okay, if somebody doesn't have symptoms, then it's rare that they would get tested because they might have false negative testing. And then antibody testing, who knows? Thank God for our community that we have Dr. Avi Rosenberg taking care of all of this. You have no idea what he's doing behind the scenes, and everybody should, if you see him, you should, from 6 feet away and with your mask on, say thank you. Thank you, Dr. Rosenberg.
Thank you, Dr. Dan. Thank you, other medical professionals. Social distance. Our hope is that this video has kind of given you a little bit of base information to help you understand what's the deal with COVID.